Here's the question that I think everyone's thinking about when it comes to peptides. There are extremely popular peptides
Mhm.
that are also under fire for potentially being dangerous or having adverse effects. So let's talk a little bit more about Tirzepatide and semaglutide. Are they technically peptides? They fall into that category. And when it comes to negative side effects, is it something that we should be afraid of or something that really makes it a wonder drug as far as the benefits?
Well, it's interesting. They are peptides. Yes, they are shorter chains of amino acids put together, but they are designer. So they're basically taking GIP, which I'm not going to go into. It's a big long word, and it, which is a peptide that the body makes, which acts like glucagon, which is kind of the opposite of insulin, and they've modified it to take out any of the negative effects and to hopefully keep all of the good effects that GIP has. And so both, and that's why they're called GLP-1s. Um, and that stands for a glucagon-like peptide. And so they are actually modified, and that's why they are a medication, and that's why they are controlled by the FDA. And so again, the benefits, the drawbacks, there have been some side effects, more with semaglutide than with tirzepatide, of gastroparesis and pancreatitis, and I'm very familiar with that one firsthand. If you're taking Ozempic and these drugs, make sure that you're under a doctor's supervision and you have someone to check in with, because even with a doctor at home, my wife took some Ozempic, and um, when it was first out, and it sent her to the hospital with pancreatitis. And so there are some side effects. They may be rare, they may be more uncommon, but they are there. And so when you're using something that has been modified and considered a medication, you want to be under a doctor's supervision for those things.
I think that's perfect, just what you said, because that kind of leads into people having the misconception that because they can be really helpful and because it's naturally produced by the body, which we just talked about, it's kind of designer, it's not the exact amino acid branch that the body produces. So it is not technically exactly what's made by the body. That doesn't mean that it has zero or no adverse side effects or that it's always appropriate even for treatment. And we can talk a little bit too about body types and how for certain people it is the wonder drug that people say that it is. It helped them lose the weight. It brought down their A1C and it basically turned their life around. It put them back in control of their weight and of their body and of their health. And for others, such as what you've seen and experienced, it causes severe and life-threatening side effects. And perhaps they were not either the ideal candidate or were not taking the ideal dose for their body type.
Yes, and even so, sometimes it's not just it's an individual patient to patient thing. And
Right.
so we really want to keep that in mind. Yes, for people that need to lose weight, and weight is is the reason that they have diabetes and heart disease, high cholesterol.
Right.
These drugs have been a miracle for some people, and it's taken away all those risk factors to give them a healthier life. Plus, they don't mind looking better.
Right.
Um, they don't mind looking thin, and
Some people only go for that side
yeah,
effect when they take it.
yeah. So, but it's also been a game changer for diabetes,
Right.
and that's where originally Ozempic was for diabetes. But they noticed that when people were taking it, that most of them lost significant amounts of weight, and that's why they started to approve it and use it solely for weight loss.
Delving a little bit more into what you just said, then, that people specifically use it for weight loss, but they're not really thinking about any of the other side effects, which is really the direct effects of the medication, the intended effects. Um, What makes somebody not so good of a candidate?
Well, you have to look at comorbid issues such as other diseases, hypertension, autoimmune disorders, especially can be triggers for because autoimmune disorders are basically your body attacking its own proteins and recognizes its own proteins as foreign.
Right.
So that type of condition or body is looking for other proteins to attack. And
Right.
so
And short
since
chain aminos are just smaller versions of, because a long chain amino is a protein.
right.
So it's a protein.
And one thing that to go back to some of the basics, the amino acid chains form a shape, and
Right.
that acts as a key to unlock a receptor. And so these peptides would not have any activity were it not for it to cause an activity on a cellular level by plugging into the lock to open that reaction in the body. And
Right.
so those people that have sensitivity or autoimmune disorders tend to react more extremely to proteins. And that was actually one of my wife's situations is she had an autoimmune disorder when she was earlier on in life, and got past it in a way, but you never really get rid of it.
Right.
And that's probably one of the reasons why she had a reaction like she did, and such an immediate and severe reaction.
I do want to ask you a bit more about that. When or what circumstance or what peptides might you need to adjust dosage as you are on the peptide? For example, I know Tirzepatide, usually after you have an initial low dose of getting used to the medication, you have some positive effects. But really, when the medication takes effect is when you take a full dosage. But sometimes people find that the more low dosage or the micro dosage is actually more beneficial than taking the full dosage. What are your thoughts on that?
I don't think with the GLP-1s, I don't think that there is um, you're working up to a dose and you're developing tolerance along the way either.
Interesting.
You are
Okay.
actually just increasing your dose, letting your body get used to the medication and finding the dose that's right and working into it slowly so that you try to avoid getting the negative side effects, which can be nausea and vomiting and diarrhea and some of those other things that are usually GI related, or just kind of feeling bad, headaches, low sugar, because the GLP-1s were originally designed for diabetes and they level off your insulin response so that your sugar doesn't rise very much. And so if you're taking too much, you may actually push yourself into hypoglycemia, which can cause visual disturbances and headaches, low sugar, because some organ systems only respond to sugars. And that one of those is your brain. Your brain can only use sugar as a substrate. And so when people go into ketosis, like on a ketogenic diet, they have to convert those ketones into sugars in the brain, which is possible, but is a more difficult process. And so that needs to be geared up in the body. And so a similar sort of thing when we're dealing with the GLP-1s, your body has to gear up mechanisms to supply your brain sugar because there's not as much floating around your system.
Right. I've actually never heard that before. So,
Well, it's, I always like to think about things logically and make sense out of them and take things to the extreme. So if you take it to the extreme, then you get clarity. So what about taking 20 milligrams of tirzepatide? What sort of effects are you going to get? Well, you're going to feel pretty awful.
right.
And you're going to be hypoglycemic, and you're probably going to need a glucose infusion to keep your sugar levels up, to be able to have any in your body to work and function, give your brain function. And so you've got to pay attention to those symptoms, and you've got to, you're not just going to lose weight faster. Yeah, you probably would lose weight faster if you can't eat anything and you're throwing up all the time, but you also might get dehydrated and be near death and have multi-organ system failure if you allow yourself to stay on that higher dose. Yeah, you might be losing weight, but not in a good way. Usually the GLP-1s, a pound of weight loss a week is a good standard to follow and is a healthy standard to follow. And some people lose a little bit more than that. If you're not having any side effects, that's okay, and to lose more than that.
Right.
But if you are having side effects, then it's something you need to pay attention to and back off. And even if you're having side effects and you back off and you're losing a half a pound a week, that's still acceptable. It's better that than enduring a lot of the side effects.
This ties back into being so used to gaslighting ourselves about our health or convincing ourselves that the side effects we're experiencing we need to get over, or they're not real, or you're just, this is hard, but things are hard. It's not the case. And that is the first time I've actually heard any doctor say that, hey, that dose might just not be right for you. It's not a means of working yourself up to a dose that is the right dose because everyone should be taking that dose to lose weight. That's not how peptides work. I've actually never heard that before.